I want to thank the Minister of Health for bringing water in the schools, fruits in the schools instead of snacks and juice and soft drinks.
Welcome to Dependency TV,
reality TV at its best,
where every life is a biography.
I am Garth Sinclair.
And I'm Natasha Nunez. Today on Dependency, we explore the topic of non-communicable diseases, NCDs. We speak with a woman who lost a leg to diabetes. How has her life changed as a result?
We will also speak with an expert from the Ministry of Health about the danger that lifestyle diseases pose to the well-being of so many Trinbagonians and the Ministry's public health education on NCDs.
I was a lover of sweets. I used to make wedding cakes, tambourine balls, sugar cake, pone, everything sweet. And I had a weakness for sweetness. So I will touch and taste too much. That didn't have a limit. I did not limit myself in sweets. I just took life for granted in those young days and just thought that life would have carried on healthy in all the days of my life. But there came a time when the sugar, the sweets, consumption of too much sweet began to affect my body. So I went to the doctor. Thank God for Trinidad and Tobago Health Services. I went to the health center and was diagnosed having diabetes. I didn't have to pay the doctors, which I must say thank you, Lord, for the health services of Trinidad and Tobago. I saw the doctors, was given medication where I took in my medicine prescription and got it all free. So I began now to start seriously thinking about cutting down on sweets. Since I was young, going to school from primary school, because there was a shopkeeper around the road that used to trust me things. So I chose the opportunity to go and say, give me this, give me that, and then I'll sell him sweet drink bottles that my father had home. So I go in, and when I'm going to school, my pocket full like Santa Claus coming, everybody see me coming, running in the savannah to meet Santa Claus with the sweets in her pocket. And from a young age, I used to share sweets and get them to use sweets to do what I wanted them to do. You know, I was not always righteous as small. I wanted to be wicked. I was wicked in those days. But thank God that has changed now. So from an early age, I will love sweets. And my entire family loves sweets. About 26 years ago, I believe something was wrong. I had my last son, who was 25, and he was a very large baby. I did not have diabetes during the pregnancy, but after the baby was born, soon after, I discovered that I had diabetes. It affected me terribly because diabetes affects our joints, our different systems in our body, our kidneys, your liver. These things can be damaged because of diabetes. If you don't take care of yourself and you don't follow your doctor's advice, you will go deeper and deeper into different parts of your body being affected because of diabetes. Well, I had a spot on my toe, and when my daughter saw that the spot from my toe went to my heels was black as a garbage bag, she had to look for different options and went to somebody for help. It really never affected me because I'm a person adjusts well to what's going on around me. I know it was my fault, so I did not blame anybody else. I know if I didn't stop eating the sweets and did things in the right way, I would not reach where I am today. So I never blamed anybody, and I just live with it. I accept it, and I'm going very good without it.
The role of PAHO WHO in general, our mandate is to work with countries to improve the life and the quality of health for people in the region of the Americas. And as the arm of the WHO in the region of the Americas, we stand behind that mantra of leaving no one behind. A major role that PAHO plays generally is being that catalyst. You know, sometimes you just need an organization there to kind of push things, and sometimes PAHO is that catalyst. We facilitate, we encourage, we advocate, we bring stakeholders together.
I'm still struggling at some points. It is very difficult. From a quantity of sweets to none at all. It's very hard. But I try my best. I have changed my diet. I still sometimes feel for something sweet. Going to your health centers or hospital, your doctors, taking your doctor's advice, they will send you to the dietitian. The dietitian will give you a program that you're supposed to live the way they tell you to live. Instead of juices with lunch, you drink water. Do some exercises every day to keep the muscles in tune. And you have to want to do that so that your life could be prolonged until the time that God ready to take you out of this life, I must say. But I'm telling them about it. But you know, some children today, they hear and they don't let it go in, it sometimes falls out, but they don't want to hear they drop it out. So I'm speaking to them, I am telling them, but it's for them to realize they don't want to look like their mother with one leg. They don't want to lose any part of their fingers, toes, or anything because of not hearing and listening to advice given to them. So I speak to them. And I want to thank the Minister of Health for bringing water in the schools, fruits in the schools instead of snacks and juice and soft drinks. I frequent San Juan Hill because I live there. I started at Barataria Health Center. They were very informative and knowledgeable for me and helped me along my pathway to becoming better than I was managing sweets. You know, they spoke to you, they lecture us in the morning, before clinic starts, somebody will come and speak to us about the effects of diabetes. So we got an idea of what we should not do. We should change our life around so that we will live longer lives and better lives. Because if we don't do that, we will be suffering more. Things will happen faster to us than at a slower rate if we obey and listen to instructions and advice given to us. No problem at all, because everything is well provided and you can get it easily and freely. We don't have to pay, we don't have to study where the money is coming from to buy it. It is there given to us free. So we embrace the opportunity to go and receive what we need for us. The family must come in. I believe that if somebody is suffering from an incurable disease, I believe that the family should come into the doctors where they can talk to the family, let them understand what the patient is going through, that they will lend their support to the patient, that doctor, family, and patient can come together holistically, work together, that we will have a good ending. A better ending that if we don't follow instructions that we will have. So I want to say, if the government will bring the family, the patient, the doctor, and have a talk, a lecture to us to know what, to let the family members know what we will be going through, what we can expect to happen if we don't have their support, if they don't have us, if they don't look at us and take away the snacks or put it away where we cannot reach it. We need that help from them. Because you know, sometimes when you love something, you are weak. But if they're looking across and see me looking to sneak something, they'll move it away from me that I can, and will be a help to me and a support to me, and I thank God when that comes in place. A little hard for her because she's young and she has a life of her own, and sometimes she has to give up some place or someone she wants to go to see because of me. She might have nobody to come and look with me or stay with me or something, so she has to give up that to be there for me because I might need her at that time. So I want to give her a thumbs up and thank God for her because she's really trying her very best with me, doing the best that she can for me, and she doesn't quarrel and say, "I fed up of you and I'm tired of you." No, she always insists that she do what she has to do. When I might fly off once in a blue moon, not often, and say something, she is the one there to calm me down. So I thank God for her being there. To all the viewers out there, a word of caution to you. I must let you know that intake of sweets must be limited. We would love certain things, but we don't have to overdo it because there's tomorrow. And you can eat peace today and eat peace tomorrow, and don't eat the whole thing today, this morning, and look in the evening to get another pack, open it and finish it. So our intake must be limited, must be controlled, so that we will not suffer with diabetes, high blood pressure, kidney, whatever these sweets will affect our body with. We have to eat healthy diets, drink a lot of water, exercise, and just give God the glory and the thanks and the praise. We have to go to the health centers, are free, the doctors are free, the medication is free.
There are certain truths in life, that nothing lasts forever, and no matter how challenging things seem now, it will all pass. That the world is full of endless possibilities, and all of life is precious. But we are all connected on this beautiful earth we share together, and everyone needs someone to be there for us when it matters most. No matter who we are or where we're from, one way, one world. Live easy with Guardian Group.
NCDs are a group of diseases or disorders known as non-communicable diseases. They are also called chronic diseases and lifestyle diseases. And NCDs refers to diseases including hypertension and heart disease, cancers, diabetes mellitus, and mental illness. Chronic diseases and NCDs are extremely prevalent in Trinidad and Tobago, and it is estimated that about 60 to 70% of premature deaths in this country are actually caused by NCDs. The two most common NCDs include hypertension and heart disease and diabetes mellitus. 1 in 4 persons in this country is hypertensive, and this was validated in a study done by the Pan American Health Organization, which is known as the Pan American Health Organization STEPS survey in 2011. This survey is due to be repeated in 2019-2020, and we anticipate that the actual prevalence may increase. The prevalence of diabetes mellitus has escalated significantly over the last 30 to 40 years, and it's almost quadrupled. At this point in time, about 14% of our population, according to the Pan American Health Organization, is diabetic. There are several contributing factors to this increase in NCDs in Trinidad and Tobago, and it really follows a worldwide trend or a global trend. What has happened is that we have what is known as a demographic shift. I'm sure you would recognize that our population is getting older. So persons are getting older because of improved health systems, they are living longer, and age is related to the development of NCDs. Additionally, NCDs, also known as lifestyle diseases, are due to the impact of lifestyle factors. And the lifestyle factors associated with NCDs include obesity caused by poor diets, increased stress, increased cigarette use, cigarette smoking, and increased alcohol use, sedentary lifestyles, and lifestyles that are decreased where persons have low exercise tolerance. So those factors culminated with what is seen as a global demographic transition, where persons are now living for much longer years and developing diseases associated with old age, have both contributed to the escalation in NCDs in Trinidad and Tobago. Given that NCDs are lifestyle diseases, diet and exercise are fundamental pillars of prevention for NCDs. If you go to a physician and you get a prescription, really and truly we should write diet and exercise down on those. And when we speak about diet and exercise, your diet has to be taken from a multi-perspective level. So we have to look at having a decreased caloric intake. So your caloric intake in terms of how much you eat needs to be adjusted and needs to be reviewed by your physician depending on your activity level, your age, your body habitus, and any other condition that you may have. Then we look at the salt content. Evidence has recognized that an increased salt intake increases the risk of you having hypertension and diabetes. So really and truly, we need to really abstain from putting in additional salt into our foods and using salt-based preservatives that that are very common in the Trinidad and Tobago and West Indian diet. What we like to recommend to patients is that they use green seasonings, garlic, ginger, and fresh seasonings in place of the salt-based and processed seasonings. Another area that we need to adjust is in terms of our cholesterol intake. We love to use red butter, margarine, cheeses. We love to chunky food and add oil. And all of those products are high in cholesterol. Now, high cholesterol is actually another risk factor that's been clearly identified to cause NCDs. Furthermore, we have to look at the consumption of alcohol. Now, there are a lot of studies that have been done in the United States, in the United Kingdom, in the developed world regarding the impact of alcohol. And studies have indicated that a moderate amount, 2 to 3 glasses of red wine, would not be disadvantageous to someone who has NCDs and may be protective in a way. However, we like people to monitor their intake of alcohol because alcohol, again, increases the risk of development of NCDs. We also look at, in terms of your overall fat intake beyond cholesterol. So there are a lot of facets in terms of diet that need to be adjusted for persons who have NCDs or to prevent the onset of NCDs. When it comes to exercise, we like to advocate that you do 30 minutes of exercise at least 5 days per week. And exercise is not merely strolling around or telling me, well, I walk from Citygate to my office. That is normal, your normal physical activity. What we want you to do is to increase your cardiac output and increase your cardiac activity to protect yourself from developing NCDs like hypertension and diabetes. In this regard, we would like to recommend that you do 30 minutes of exercise where you actively start sweating. So if you're a walker, you want to walk quickly. If you're a quick walker, you want to start jogging. If you're a jogger, you want to start running. We advise people to do the exercise at times that are convenient to them and in environments that are safe. Because of course we are cognizant of safety concerns, time misuse, etc. And the fact that if there are negative factors associated with exercise, people are less likely to change their behavior. Now, NCD management requires a high degree of behavior change. And although that behavior change can occur from a societal level, as well as a governmental level where we might implement policies, at a societal level where persons can be encouraged in groups by the population, the responsibility is ultimately with the person themselves and their family in terms of how they conduct themselves and how they eat and drink.
Agricola Credit Union Cooperative Society Limited introduces its new and improved mortgage loan package from as low as 5% per annum. Home renovation, purchasing a home, constructing a home. Come to your credit union today. Speak to our friendly and courteous staff. See your dreams come true. All lending criteria apply. Check us at our head office, 20 Phillips Street, Port of Spain. Arima branch office, Pro Queen Street, Arima. Tobago office, Plymouth Road, Scarborough, Tobago. And our Marabella office, Pamela's Mall, Marabella. Agricola Credit Union, your very own, working for you.
Yes, heredity is a factor, gender and age. So when we review a patient who comes into an office, we look at the modifiable risk factors and the non-modifiable risk factors. The modifiable risk factors are the ones that we just spoke about: diet, exercise, tendency to be obese, smoking, alcohol intake, fresh fruit and vegetable intakes. The non-modifiable factors address what you just asked me about, and that was about heredity. Yes, heredity does increase your risk of having a non-communicable disease, especially diabetes and hypertension. And so it's important that if you have a relative, and as I said earlier, 1 in 4 persons has hypertension. So the key, it's very likely that each of us has a relative who is hypertensive, a grandparent or a parent. We must start actively screening ourselves from a young age, even before we think we have hypertension and diabetes. And heredity does increase the risk. There's also a racial predisposition in that, based on studies done in Trinidad and Tobago, it was found that the African population, or persons of African origin, tended to have more of a likelihood of developing hypertension and hypertension, whereas the East Indian diaspora tended to develop diabetes mellitus. Now, that does not preclude one person of one race not having the other. It just means that there's a genetic predisposition to developing diseases. The other non-modifiable risk factors include age. Of course, as a person ages, there are age-related changes, and gender. Men over 40 have an increased risk of developing hypertension. Women, once they pass menopause and they lose the protective effect of the hormones that circulate during their reproductive lifespan, equal the risk factors of men as a man over 40. So if you're not being screened as a 40-year-old man, I would advise that you go to your primary care physician and do a full screening in terms of getting your blood pressure checked, your urine checked, a full physical examination, and also having your blood test done. Yes, heredity is a factor, gender and age. So when we review a patient who comes into an office, we look at the modifiable risk factors and the non-modifiable risk factors. The modifiable risk factors are the ones that we just spoke about: diet, exercise, tendency to be obese, smoking, alcohol intake, fresh fruit and vegetable intakes. The non-modifiable factors address what you just asked me about, and that was about heredity. Yes, heredity does increase your risk of having a non-communicable disease, especially diabetes and hypertension. And so it's important that if you have a relative, and as I said earlier, 1 in 4 persons has hypertension. So the key, it's very likely that each of us has a relative who is hypertensive, a grandparent or a parent. We must start actively screening ourselves from a young age, even before we think we have hypertension and diabetes. And heredity does increase the risk. There's also a racial predisposition in that, based on studies done in Trinidad and Tobago, it was found that the African population, or persons of African origin, tended to have more of a likelihood of developing hypertension and hypertension, whereas the East Indian diaspora tended to develop diabetes mellitus. Now, that does not preclude one person of one race not having the other. It just means that there's a genetic predisposition to developing diseases. The other non-modifiable risk factors include age. Of course, as a person ages, there are age-related changes, and gender. Men over 40 have an increased risk of developing hypertension. Women, once they pass menopause and they lose the protective effect of the hormones that circulate during their reproductive lifespan, equal the risk factors of men as a man over 40. So if you're not being screened as a 40-year-old man, I would advise that you go to your primary care physician and do a full screening in terms of getting your blood pressure checked, your urine checked, a full physical examination, and also having your blood test done. Because as I indicated earlier, behavior change and personal responsibility are at the heart of managing non-communicable diseases at a personal level and a population level. So the first piece of advice I would give a patient is that you need to be screened. From an economic perspective and a societal perspective, non-communicable diseases contribute or confer a significant burden on our society. At present, a recent study that was done indicated that about 8.4 billion TT dollars is spent per year on managing NCDs, diabetes, hypertension, and cancers. And that may actually be an underestimation because it was a rapid assessment that was done and not a long-term study. That figure accounts for 5% of our country's gross domestic product. And we can think about if that money was to be reallocated into other areas, let's say, for example, schools, roadways, transport networks, how profitable and how much more useful that money would be spent. That being said, we as persons need to really accept, and we need to be the impetus for change. So if you have relatives, yourself, starting with yourself as a person, and your relatives in your home, you want to advocate for them to be screened. When you are screened by a physician and a district health visitor, as in our primary healthcare system, we are able to analyze and to identify what your modifiable risk factors are and what your non-modifiable risk factors are. And from those risk factors, now we can give you advice. Being a person who says, I don't have this, I am slim. I actually heard someone in the gym yesterday say, I know I don't have high cholesterol because I'm slim. Those are erroneous sorts of statements. You can be very slim and have a high cholesterol level and have a risk factor. So the behavior change starts with the individual and a recognition of what causes NCDs, hypertension, diabetes, where they may lead to in terms of complications, and having a screening done. Once that screening is done, you now move to adjusting your modifiable risk factors. So you're going to adjust your diet. Now, I understand that it is not easy to make a sudden change in your diet. So what I advise people to do is to look at the diet change in a very structured way and you have little rewards and little gains. So you may say to yourself, you know what, I'm going to cut back on my cholesterol intake this month. So, you know what, I'm going to only have a macaroni pie one Sunday for the month. I'm going to substitute it with something else, maybe some provisions. And you make it into an exercise and you reward yourself. So, okay, so my family, we've done so and so, and we have reduced our cholesterol intake. So, let's reward the kids with, some fresh fruits at the beach or so. So you have to incentivize behavior. Beyond that now, you have to look at the exercise part. And exercise can be a bit daunting for people. I know a large percentage of the population is stuck in traffic, commuting daily. People have other commitments. There are safety issues. So you need to get a team together. Research has demonstrated that when people exercise in groups and teams, it is a motivational factor. And once you start exercising and you start feeling that endorphin release, you will become hooked. So we would like to move people towards exercises. Now, there are a lot of communal exercise areas. For example, there's in the King George V Park in Port of Spain. If you go there on an evening, it's very well lit, illuminated. There's a lot of equipment for children, for parents. There are walking areas. So persons of all ages can benefit from being there and exercising. In terms of behavior change, again, smoking really should not be done. And if you have a smoker in your home, the risk is not just to the smoker, but to the persons who live in the household. And smoking, in addition to the NCDs, creates a lot of other significant health problems, and as well as a high cost in terms of maintaining the habit. So if you're a smoker, we urge you to go to your primary healthcare centers, speak to someone. We have smoking cessation clinics where persons can be advised on how to quit smoking. We admit it's not an easy process, but it's something that we would like persons to admit. Go with a family member. There are support groups and we will help you quit the habit. You'll have a lot more money in your pocket. You'll feel a lot more active. With respect to alcohol, alcohol should not be something that's a habit. If persons want to drink alcohol, again, treat it as a reward or an incentive. But persons need to be aware of the binge approach. What I would like to tell the population is that making a shift in behavior is not always easy. There's pain from exercise. People feel hungry initially. People might not think they have time. You know, there are a lot of competing priorities in each of our daily lives in Trinidad and Tobago and for any person at all. But you need to look at the long-term benefits of changing your behavior. Find a partner, get a team, incentivize good behaviors, and you will have success. And once you see the pounds coming off, persons get really motivated. The Ministry of Health's website, www.health.gov.tt, details all our primary, which are health centers, and secondary institutions. So that is one good place to start. We also have a Facebook page, which we will post, and that again indicates where persons can seek information. Information regarding hypertension, diabetes, and cancers is readily available at all our primary healthcare centers. And the reason I'm referring persons to the primary healthcare centers is because we have well over 100 health centers throughout the country, from Grand Riviere to Matlot to Arima to Diego Martin to Deep South, and in Tobago, of course. And persons can walk in there anytime between 8 to 4, and in some health centers we actually have an evening service till 8 p.m. and they can have a conversation with a district health visitor, a physician, and a pharmacist about their condition. We encourage people to go in and have the conversation first. A lot of persons are in denial and they're afraid. They're afraid of having a diagnosis, being put on medication long term, possibly having complications with the disease, believing that they are now losing control of their health, and so on. But I want to urge persons that early recognition of the problem is the key to successful management. You are not alone. There are several hundreds of thousands of persons in the country with diabetes, with hypertension, with cancers that live regular, normal, productive, and happy lives. But you need to recognize the condition at first. We advise persons to go into the health centers. As I said, we have a full cadre of multidisciplinary staff that can provide advice on all areas, including how to manage your day and stress management techniques. Because stress, of course, in combination with all the other lifestyle factors, increases your risk of diabetes and hypertension and some cancers.
Some of us like to play games of chance, but remember, gaming should be fun, so don't get carried away. Play for a prize, but don't pay the price. Play for fun, but never for keeps. Play smart, but never play all. Winning isn't everything. If you or someone you know needs help, call our gambling addiction hotlines. Rebirth House 24-hour hotline 466-3146 or Serenity Place Empowerment Center for Women 648-5401. An initiative of NLCB and Eye on Dependency.
Diabetes, hypertension, heart disease, and other NCDs affect us all. But prevention is better than cure. Living a healthy lifestyle is so important to prevent the onset of these and other ailments.
Join us next time for another informative edition of Eye on Dependency TV. The topic, alcohol-related diseases. See you then.
Eye on Dependency. Reality radio at its best every Sunday from 6:15 to 8 p.m. on I 95.5 FM. Don't miss it.